easier for you. My simplest description of pain is actually something that is communicating to your body. It's a very uncomfortable sensation, I agree, but it's a pivotal way of our body telling us that we need to do something or stop doing something. That's how simple I just want to describe pain. So you could be going through that process, but I know Daktari in studio will help us really define it in a better and give it better medical terms. His name is Dr. Wasena Angira. He's an orthopedic surgeon and a pain specialist. And of course, today we are going to be talking about managing pain with a special focus on non-surgical ways of managing pain. Karibu sana, Daktari.
Asante sana.
Yeah. An interesting question maybe one would like to ask. Let's start there. Why would a surgeon be talking about non-surgical ways of managing pain? Why is that important?
It is important because as a surgeon, our ultimate goal is to manage the patient as a whole. And having been a surgeon for some years, I've realized over time that there are areas you really have to try to do non-surgical means, because even after surgery, you find that the patient is not satisfied. Mm-hmm. And I have been having chronic pain personally for my back. I've been a surgeon for some years, so I do stand a lot. And I realized after standing for many hours, when I get back, I used to get a lot of back pain. And to an extent that at some point I was almost stopping to do surgeries. So I started to look at what are the modalities I can use to help myself. I did a few investigations, of course, X-rays, even MRI, and I felt that we discussed with my colleagues. We thought of doing surgery, and then we opted, let's try a non-surgical means. And I realized it actually works. It just needs a lot of patience. It needs a lot of commitment from you as a person, as a patient. And you come to realization that some things you live with, and see how to live with it in a right way. So that's why I'm passionate about non-surgical management of pain.
Of pain?
Yes.
Wonderful. You know, you said there, like sort of like on a light note, that I've been as a surgeon for a few years. Yeah, but I'd just like us to tell us a bit more about yourself. You know, you're actually somebody who is very renowned in the industry, just for us to understand a bit more about you.
Yes, I'm an orthopedic surgeon. So orthopedic surgeon, I deal with bones and joints. And so I treat people who have fractures, and I treat people who have joint arthritis. That is hip arthritis, back, knee, all kind of joints can get affected by arthritis. So in so doing, when I was starting the practice, I was very excited about doing surgeries. And I could do, I get patients with maybe knee arthritis, and I feel like they need to be operated. We go in and operate them. Then over time, I realized, can we put some patients on some regime?
Yeah.
We don't do the surgery. And then let's do surgery on some. And then we see the level of satisfaction of these patients. Then we realize that over time, there are patients who really, really need surgery. So there's no way you can.
So surgery is also a way of managing pain. It's one of the options.
Yes.
But there are other ways.
There are other modalities that you can use. So we and it's world standard that you classify the pain into different categories. And depending on the category where you are, you can opt for non-surgical management. And this non-surgical management are stretching all the way from your diet to your lifestyle. And and to medicine.
To medicine.
And in medicine, we need to try as much as to limit the painkillers we take, to opt for some things that are not relating to the painkillers that we take every day.
All right. Doctor, we'll go there because that is like the basis of our conversation today, just talking about non-surgical ways of managing pain. But let me take you back a bit to the very basics. Just understanding pain. When I was introducing the show, I said it's a way of the body communicating, but in a better, proper medical term, yeah? Help us understand what pain is and, you know, how it helps our body or otherwise.
Yes, so imagine if you didn't have nerves to sense pain and you're going to hold on a hot sufuria. What will happen? You will not feel the sufuria is hot.
You'll burn yourself.
What will happen is that you'll burn. And when you burn, it causes another problem. So the fact that the sufuria is hot, when you go to hold it, it will trigger a nerve communication to your brain that this sufuria is hot. Then you'll drop it. So that's pain. And it's alerting you that you're getting into trouble. So pain is a sensation, or it's a feeling that you're getting into trouble. Or if you overdo something, you'll get into trouble. Imagine you're exercising. You've gone to the gym and you're exercising, and you want to lift that heavy weight, and you start feeling pain. What it tells is that you are overdoing it. So basically, that's a sensation of pain. But pain is divided into what is called acute. This is now where it is the immediate, or pain that happens in the immediate setting.
So these are the categories of pain?
Yes, category of pain. So it can be acute in that it's an immediate thing. You feel the pain. You're going to hold something. You feel the pain, or you are playing football. You get hurt. That's an acute pain. But pain can be progressive, and it can last for long. Like an example of people like us who have back pain. You had the pain initially. The trigger did not get eradicated, so it continued. So it caused what is called now chronic. It's almost there throughout. So that's another category. You can also divide this category into what is called into how we sense it. Pain can be due to what you call neuropathic. Neuropathic is the pain that is as a result of nerve being either pinched or nerve having a sensation. An example is, let me go back to back problems. There are some patients with a back problem, but they will not tell you they have a back problem. They'll tell you they have pain that is ongoing on their thigh and all the way to their toes. But when you touch their toes, they can't feel the pain. They'll tell you, I feel the pain at my toes, but their toes is completely okay. So that is neuropathic pain, because it's a pain that is going to it's across this, passing through the nerve. So the nerve is being pinched at one point, and you feel the pain at the other point, at a different location. People who have diabetes, for example, people who have had diabetes for long, they tend to get neuropathic pain. They'll tell you, I feel my hands are painful, or my toes are painful, but their toes are completely normal. And so when you look at it, that the pain is their nerves that have been having a problem. When you have sugar, uncontrolled sugar, there's a way it messes up with the nerve, and therefore you feel that sensation of pain. So those are neuropathic pain. Then there are pain that are coming from an injury to an organ or to an area, like a muscle pain. It's called somatic. And when you have pain on your abdomen, for example, it's called visceral pain. That's why ladies, for example, with cramps, will feel pain along their abdominal wall. And the way they manage their pain is different from somebody who has pain on the muscles. So those pains are completely different. Then we have now functional pain. Functional pain. Patients who have a heart condition will say they feel pain on their chest that goes to their shoulder, and they feel the pain when they walk. So a patient who has a problem of the heart will say, when I walk around 20 meters, I feel pain.
But when they are in a restful position, they don't feel anything.
They don't feel anything. So that is pain due to the strain on the function of the heart. So the heart will not feel the pain, but it will refer pain to the chest and to the shoulder, the left shoulder. So that's functional pain.
All right.
So different pain, and as I said, pain is helpful because it shows you that there's a problem somewhere. You can imagine if this person with a heart problem did not have pain, so the heart will continue to get bad, and they will never notice.
They will keep overdoing the walking or the running without knowing that they are straining the heart.
The only side of it is that, again, it depends with the information. I've seen patients when I was still a general practitioner who have a heart condition. They've been presenting with their pain, and somebody thinks it's ulcers. So they've been taking antacid. So again, it's also good to know, to have a general knowledge of your health. And also, I know our medical practitioners are also getting more information so that they really...
So it really points out to the need of awareness so that you get the proper diagnosis. Because the way you're describing it seems like different pains could be signaling different things.
True.
So not necessarily that because I present with chest pains, that my chest is the issue.
True.
And I may end up getting treatment for the wrong condition for long, only to realize that probably something was getting worse somewhere. So on both ends, from the patient to the medical practitioner, there is need for awareness to understand the categorization of these pains and what they could be communicating to us.
Sure.
Yeah.
Sure.
All right. That's good to know. You know, pain comes in different ways, and it's good that we both agree that in as much as it's uncomfortable, it's a good thing because it's telling us that something is off. But you know, there are pains that warrant a trip to the doctor, but there are others that are not necessarily, you know, pushing you on there is no need for you to go to the doctor. So talk to us about, even as you've taken us through the categorization, what pains should signal us to really take up that trip to the doctor? Which ones now warrant that? The dangerous ones that we shouldn't ignore.
I think anything lasting, okay, let me put it this way. If there is an obvious cause that you're aware of, then you don't need to go to see anyone. Let me give you an example. If you are walking and you tripped and you feel the pain and you feel you can still move, then you probably can treat it conservatively at home. And this is where I talk of the regimen for what we all know from high school or primary, the RICE, where you do rest, you put some ice, and you elevate. So of course you have those modalities, like if you are walking and you tripped and you're feeling your knee is painful, at that time you can just rest it, put some ice on it, elevate it, and then you observe. But in 3 days, if the pain is still persistent, then I think it's just good to go and see a doctor, because probably the muscles have been torn, or there's a small fracture, so you need to go see a doctor. If the pain is lasting, and again, it's a duration, and this is a very tricky balance. I'm giving an example of my brother who used to have chest pain, and he was to go to a chemist, and he was being given antacid. Then all new for him to explain to me, and then I'm like, I think you need to see a doctor. So I think, again, it's a tricky balance. If it is progressing, maybe, to me, I usually take around, if you have an obvious injury, like what I've said,
that you know
this
pain is because of this,
then you can rest.
Yeah.
But if it's something that you can't pinpoint on, and it's lasting more than 3 days, it's good to see a doctor. And I'm digressing to another area that is not mine. An example is appendix. When I was a general surgeon, we could see a patient who has appendix. So he says, I've been having this pain on my lower abdomen, and I went to the chemist, I was given Buscopan, and but it's still there. Then I went back, I was changed from Buscopan to diclofenac. So by the time I examined this patient, he has inflamed appendix. So, I mean, it's just more of a judgment call. When you see something is a bit, this is something I can't pinpoint on, just see a doctor so that we are able to pick it earlier. Because if it is picked early, it becomes good for all of us.
Yeah.
Yes.
Because with proper management, I assume the pain should be reducing in intensity. Even if you're doing the management at home, whatever it is that you are feeling on the first day should be reducing in intensity as the hours and as the days go by. But if you notice that, regardless of what you're doing, the pain is actually either the way it was on the first day or it's progressing, then there is a need for you to check that. Seems like whatever you're doing is not working, or you're treating the wrong issue. I want us to talk about the most common pains, the body parts that usually are the most notorious when it comes to pain. There is even a joke that women, when they get to a certain age, there is a certain level of pain that is normal, you know, in certain areas of the body. I don't know whether that is true, but just run us through the body and the most notorious parts that you experience patients saying they have pains, and probably what could be the issue. Earlier you talked about lifestyle, diet, you know, just run us through the basics we need to understand about these parts and the pain that we feel in those areas.
So from my experience, the number one area that has pain, and which I think about 80 to 90% of the population will feel at any one time, is the back.
The back, yeah. The
back is especially the lower back. And there are several issues that contributes to this. One is our normal anatomy. There's a way our back is meant to have a certain curve. And with time and with our lifestyle, we don't maintain that curvature. Like this way, the way you are seated is the right way of sitting.
Oh, yeah.
Yeah, so you need to sit upright.
Upright.
With your,
sometimes you forget and you go like,
yes.
So it's not the best.
But when you look at our lifestyle, we tend to stay in the office for long hours, and you will tend to slouch back, forward when you're in front of your computer, or even in classroom, when you're writing your notes, you'll tend to curve like this. And our classroom is not made so that the table is a bit up so that you write when you are almost on an upright position. You're going to curve. Yeah. So from the time from our childhood, we've already messing up with our back.
So we pick up that sitting posture.
Yes.
From when we are young.
From when
so you are saying it's actually wrong. We should do something about that.
Yes, our sitting position all the way desks. From school need to be changed, because when you're sitting and you're curving your neck, you're curving your lower back. So that sitting, the desk needs to change. And I hope some people in the education will do something.
And I hope you're picking this. The desks are too low. The table is too low for the chair. So you have to which is wrong.
And then when you go to the office, it's the same thing.
Yeah.
When you're driving, it's the same thing. So it's something that we're progressively messing up with our back. So that makes a strain on the lower back. And a big number of patients will come complaining of the lower back, and when you do an X-ray, you'll find that their muscles are tight. And their muscles are tight, and because of the curvature that they've done. And unfortunately, and I'm guilty on this, that due to the number of, probably you go to a public facility and you're seen, and the doctor will see and tell you, oh, your back is straight, so he'll prescribe for you some muscle relaxant and tell you to take this medicine. Then you go home, you take the medicine, and you continue with your lifestyle. And so this does not help. I've realized that as a practitioner, taking a few minutes to explain to this person that your back is straight because of your lifestyle, and you need to change 1, 2, 3, significantly changes this patient's way. And the next thing will take you is you'll probably go to physiotherapy, and you'll be told you'll be massaged and you do some things on your back, but you're not put on a program for your back. That actually from our papers, we realized for the initial period, doing home exercises saves up to around 70% of stopping it from progressing. Because now you're being told, for this, because your back is curved this way, there's a way you need to do this exercise to get back to your normal curvature. There are some exercises that you need to do to strengthen your core abdominal muscles and your back muscles. I've seen patients who they're told their back is a problem, they go to the gym. Then, I mean, most of us happen to be in the mid ages. So what happened, your abdomen is also starting to get a little bit bigger, you're starting to get belly fat. So you're saying, oh, you have back pain, okay, fine, do these exercises, and you need to cut on your abdomen. Then you're starting doing sit-ups. Then now those sit-ups
make it worse?
Make it worse.
Make it worse, yeah.
Yes.
So exercise is good, but also
the right
you need
exercise.
to know how to do it right.
Like if you have back pain, is your problem what you call flexion or extension? So if you're doing flexion exercises and you have a problem with your flexion, then it's going to make it worse. So when you come to see the doctor and coordinate with the physiotherapist, we should pick where is your problem. Is it in extension or is it in flexion? And then now we put you on regimen. And this is why I insist on managing it at home. Because you come to physiotherapy for 1 hour, and 24 hours
you spend it away from
physio.
So the burden is on the patient.
The burden is on the patient.
When it comes to pain management, it's actually the patient that carries the big burden on achieving the best results.
Yes.
Okay.
So I was saying the back is one of the biggest issues.
Yeah.
And and again, I don't want somebody to talk about things that this is now the only machinery. We have, like when you're a younger person, most of the pain is due to muscles and imbalance. So you can stop this progress. Of course, when you're somewhere in your 50 to 60, now arthritis are setting, and there are other modalities that can be employed. But if you start managing it earlier, it prevents you from getting into that. The other thing the other next place where we need to focus on is the knee.
The knee, yeah.
So, and I've seen this currently. There's the number of people going to the gym has increased, and we thank God for that. Because, but
I hope it's not peer pressure.
it's good. It's good.
It's good peer pressure. Then.
Yeah, but I've realized again, the number of patients with knee issues has increased. So the knee, there's a part of it called patella. So there's a way the patella needs to move along that joint. So if you don't strengthen it, if you don't strengthen the muscles on the inside, that's the medial part, the inside of the thigh, tend to be weaker. The muscles on the outside tend to be stronger. So as we practice, we make the muscles on the outside stronger. So the patella tends to move on the side. And we call that patellofemoral syndrome. So when you get the pain, and we need to also coordinate with our gym instructors. When they see the pain, they don't tell them, hey, just continue pushing on. You need to know what is it. Could it be the patella that is maltracking? And so that we put you on exercises that strengthen the medial side. And unfortunately, if this patella continue to move in the wrong direction, you get destruction of the cartilage. And that destruction of the cartilage will make you start feeling pain. And that destruction of cartilage will later on cause arthritis, because arthritis is basically destruction of the cartilage. So we start with patella maltracking, which is called patellofemoral, causing cartilage damage, then causing arthritis.
So what began initially as a good thing, as exercising, which is good, ends up leaving you with another condition.
Exactly.
Yeah?
But it's not only on exercising, but there's some people, as I said, our lifestyle is geared towards a strengthened, like even when you go to the farm, when you are, farming, that exercise alone tends to strengthen the side from the outside. So you find that somebody who has been a farmer, then they get this pain. They say, but I've never been. But again, you see that. So when you feel this pain initially, just see a doctor, and we may not even put you on anything. We just put you on proper exercise to bring now that patella to the normal area. That making that joint to move is okay, and prevent the later on problems.
Yeah. All right. There's also another common type of pain, especially among women, usually compared around the waist area, the lower back. What could be, some of the most common, causes of this, especially in women.
In women. So of course, the women at some point, due to hormones, they tend to gain weight. Especially if you gain weight suddenly or rapidly, like in pregnancy, it tends to cause now problems on your lower back because of that weight. So that sudden change of weight is also a problem. And of course, the women tend to be, unfortunately, the one to work in the house, and with progressively they hurt themselves. Tell me any house, okay? Most of the houses, the ladies will be bending as they mop. It's nowadays that they tend to use something that is long to mop, but most of the time they bend. When they're washing clothes, they bend. When they're cooking, they bend. So that also progresses and creates more injury to their back.
All right. And we are not saying women should not work, eh? Don't quote us. And
it is just the proper way of doing things.
All right. So we want to get into now the pain management strategies, because you've talked to us about the categorization and even taken us to the ones that really need to go to the doctor. I want you to tell us a bit about what are some of the the things or strategies or options that are currently out there that people can use to manage body pains?
Okay. Again, I started by talking about lifestyle. That to me is the number one way of managing and preventing the pain. If you notice you are going to have, maybe your back is having a problem, your knee is having a problem, you need to look at what is causing it. So you have to check what is the trigger point, what is triggering this pain to occur. Then you can avoid it. Then number two is just basic working out on how to improve on it. If you are losing weight by about 5 kgs, improves your pain by around 20%. So if you're obese, losing weight, putting yourself on routine exercises is important. The other thing is our diet. And there are some food that we take tend to lower inflammation, like turmeric. Turmeric has an element called coumarin that reduces inflammation. Ginger is really good is an anti-inflammatory. We have other food like garlic is also good as an anti-inflammatory. There is also, when you look at some of the supplements we take, there's a supplement called glucosamine chondroitin, which most ladies in there will be taking. And this basically it's derived from fish. So if you take something like fatty fish, for example, it's good to reduce inflammation. There's also something, it's common in the US, called avocado soybean. It's a mixture of avocado and soybean, but that's processed to get the elements of it. But you can also make that at home. You mix avocado. So if you have some pain, inflammation, and this is mainly for...
These ones you take when you have pain, or they could also help prevent?
It's also just like a routine. You need to take this routinely.
Make it part of your daily.
Make it part of...
Or regular.
And they're an anti-inflammatory. And there are some foods which inflame. And like, okay, alcohol is one of them.
It's a red button you're touching. Yeah? So alcohol can cause pain.
No,
make it worse.
It triggers inflammation. Like if you have, for example, if you are borderline, you can get, if you have like maybe red meat, those things they cause inflammation and they trigger. Red meat, alcohol, smoking, those trigger. I'm not saying they cause, but they trigger inflammation.
So you are safer if you can avoid.
Or
regulate.
Or regulate. And so the other thing is that the modalities you can use now, let me say you have back pain. What are the things you can do at home? And even if patients who have generalized arthritis, one of them is HIIT modality. When you go to any hospital, or for those who've gone to the hospital, before they have physiotherapy, there's some HIIT pack that will be placed on their back or on their knee. So if you have hot water bottle, if you feel some pain and on your back or on your knee, just take something like a hot water bottle, put on your back, or take a warm towel, put on your knee. Then immediately, when you feel when that heat modality reduces the pain threshold, then start exercising it. So it's something you can do routinely. When you wake up and you feel some pain on that area, just take something warm and put in that area, then start exercising it. I don't know if I've talked too much, but you can...
No, it's okay. I mean, the more you share, the more we are getting tips on... Actually, what I like about what you're telling us is mostly it's what we can do at home. There's very little that is done in the hospital. So this is mostly what you're sharing is things that people can begin doing at home to manage the pain that they're experiencing, even as they add that with what they are getting at the medical facility.
Yes, so I'm not saying there's much you get from the hospital. But when you come to the hospital, is 1 hour in 24 hours.
Yeah.
And you can't come to the hospital every day.
Every day, yeah.
So let the hospital be supplement what you do at home. My mom was back issues, knee issues, and it's really been a fight with her because I know her modality, the best thing she should do is to get out there and walk. But for some strange reason, in the village, she was told when you have pain, don't move. Don't move. Just
walk a lot.
Don't walk a lot. And it's distressing because...
and it's not your mother alone. There are so many Kenyans.
I'm trying to change that narrative, and it is so difficult because the more you sit, the more your muscles become weak.
Yeah.
The more your bones become weak. And when your bones become weak, and as you said, of course, for the ladies, and even as we age, our bones become weak, something called osteoporosis. So when your bones are weak, you can't even do much. And if anything happens to you and you get a fall, you'll get a bad fracture. So what I'm saying, when you have pain, you need to break the vicious cycle of pain by getting out there, moving your body parts, and keep on moving. Of course, you should not overdo it, but regulated.
All right.
Yes.
Be active. You can start small, walk a small distance, come back at home, rest. The next day, stretch it a little bit. You can go progressively like that until your body gets used to it. I wanted to take me to the medical facility. Is it St. Peter's?
Yes.
Like at the medical facility, for example, where you work, what are some of the things that you do that are not surgical, that you can help a patient who is having body pains, manage? Yeah.
Yes. So we treat each patient differently, and as I say, we categorize. Like if you have a knee pain, there's a degree where you must have surgery, but there's a degree where we are trying to explore new modalities. Like there's something called stem cell. So we get your blood and inject. We produce something called a stem cell, and then we inject. For earlier patients with grade 2 arthritis, it tends to really work well, and it prevents you from having surgery. So our number one thing is always move. So we want to put you on exercise, and then we want to be adamant. Hata kama unakosana na sisi, we want to know, have you been doing this exercise when you are at home?
All right.
So then number 2, we follow a close follow-up on that. Are you using the right modalities to do this? Right. I was giving you an example. I know time is running out.
Yeah.
There are some patients who have back pain, but they don't have just back pain. They have pain that's radiating to their legs. So that's called sciatica. So there's a nerve that is being pinched at the back. So maybe you have a disc prolapse. Earlier on, we were aggressive by going to do surgery. But we realized after 1 year down the line, you are going back to where you were.
Yeah.
So we are trying to push them to do exercises that are trying to make that sciatica to stop.
All right.
So there's a regime that is only that we are in the studio, can't demonstrate. But we on our website, we have a website called Afya 24/7, and on our Facebook page for St. Peter's, we've placed some exercises for the back. If you have sciatica, we place some exercises that you can do to prevent that pain.
All right.
If you have knee pain, at an earlier age, there's some exercise we've put for you. If you have knee pain when you're older, there are also some exercises that we put for you.
We are running out of time, but you had promised to do a demo for us.
Yes.
Maybe I'll just request you to quickly just stand and come on this other side.
Okay.
Yeah, just to show us. It was about the back or the knee? This is a practical session now we are getting into. As we close this, as we wind up. So you just run us through a quick demo, something you can do at home.
So I'll start with foot. There are quite a number of patients with foot problem, especially at the heel. So because that foot problem, the problem is usually what you call plantar fasciitis. So you need to stretch your plantar. So you need to put something on your foot and just roll like a ball. When you wake up, you just roll on your knee, on your foot. Then you stand on the wall, then stand up, stretch it up and down and count to 10. You stretch your foot and count to 10. And count to 10. Then
count to 10 while up. Then you come down. 1, 2, 3, 4, 5, 6, 7 to 10. Then you come down. Great.
Then you continue. That is on the, and this significantly helps, and you don't even need to take any medicine. And that is for that. I wanted for the back, just stretching your muscles will stretch these muscles and make them tight. There's some modalities where you go down and bring this up and down, up and down. And believe you me, about a big percentage of patients just get relief
out of that. Is it something you do like on a daily basis?
Make it a lifestyle.
Okay.
When you wake up, after brushing, before you take a shower, stretch your back muscles. If you've been having back pain, like for everyone who works in the office, to some extent, about 90% of us will get some back pain at some point. So to prevent that, just make it a routine to also strengthen your core muscles.
All right.
Yes.
Thank you, Dr. I believe one of these days we should now have another session that is practical, because that has really excited me. Yeah. Just to show us the practical ways, what things people need to do, like on a regular basis at home to be able to prevent those back pains. Of course, that is how we wrap it up. I've been having this conversation with Dr. Wasena Angira. He's an orthopedic surgeon and pain specialist. Of course, we were just talking about managing pain without surgery. I believe you have gotten a few things that you can be able to embrace in your lifestyle that can help you prevent. And even the next visit you go to the facility, now you know what to expect and what can be done there to help you manage the pain you're experiencing in a better way. Thank you so much for watching Citizen TV until there, but we still have a lot that we are working on for you, so keep watching. My name is Safin Achieng Oma.